Afisayo is with us. He's been in the tech epicenter of Africa. Which
Really?
is, yes, now.
Okay, I've been in Nairobi. I'm not sure about tech epicenter, but yes, I've been in Nairobi.
How's the tech scene going on there, Afisayo?
Yeah, good. I mean, a few things that I've observed even before I left.
Yes.
But also, I had to just, it became stark reality to me when I spoke to entrepreneurs, African entrepreneurs in Kenya. I think it's not a conversation, but of course, the funding ecosystem in Kenya or in East Africa is largely skewed towards foreign founders. And I think, and I think it's taking a huge toll on African founders founders of Kenyan descent. So they are not able to raise money, even though their business is might be doing very well. So some of them are forced to get a foreign co-founder to ensure, and then we have examples of such already. I don't want to mention names, but if you look at some of the recent what's it called,
funding raises,
you'll have noticed something in common.
So we need that foreign money.
Right, so that's just the way it is. But unfortunately for them.
Thanks for that synopsis there. That's summary. Shout out to AIE. He knows why I'm shouting him out. He was vexing for me yesterday. AIE, we appreciate you on the show and everybody else. 0809 444 0981. Do send in your messages. Fisayo, this isn't really tech, but then it's medical science. We can mix in the coronavirus. They've got their first case in Nigeria. I think it was noticed at the Lagos University Teaching Hospital, part of the laboratory network of the Nigeria Center for Disease Control. There's at this point, if technology could have done anything as far as vaccines or anything at this point, it would have happened already, but it hasn't. So I'm still in a stage where everybody just has to be careful. What have you been washing your hands?
I've not been doing anything. So for me, I just think that a few things need to be clear, right? If I'm going to name this virus, I'm going to call it the Chinese coronavirus. And I think it has to be clear that, yes, it's Chinese coronavirus.
Yes.
Because, recently, they're talking about the swine fever in China. They called it the African swine fever.
Yes, or swine flu.
So, but here, it has to be clear. We have to make it public that, yes, it's the Chinese coronavirus that we're talking about.
So we can label it properly.
So that it's labeled properly. That said, I think, Nigeria seems to have handled, at least Lagos, seems to have handled, infectious diseases before. This is more contagious than Ebola, right? But again, we have to trust that the government is doing what they say they're doing. They're able to, quarantine, keep people that have had contact with some of these people already, keep them in safe place so that the infection doesn't spread, and then everybody just take precautions. And I think that's just all we have to do.
I need to point this out on the medical science part of this. This was, I didn't mention this. This was an Italian citizen, right, that has this. He was, been observed by the virology laboratory of the Lagos University Teaching Hospitals. How many more of these virology laboratories do we have across
virology?
Exactly. So how many interesting. We don't
I'm not sure.
Right.
I'm not sure.
It always seems to be Lagos that is able to handle these things.
And also
this is not
teaching
spread.
Hospital.
Exactly.
So I expected the teaching hospital to have it anyway. I'm not sure how deep or the laboratory penetration in Nigeria. We are 200 million people. If everybody has to go to Luth to get every treatment done, it's just the way it is. But hey, we'll figure it out one day.
All right, Lagos. Remember the as far as the health ministry and everyone else, wash your hands thoroughly, soap and water. Maintain at least a 1.5 meter, 5 foot distance between yourself and anyone who is coughing or sneezing. Persons with persistent cough or sneezing should stay home or keep a social distance, but not mix in with crowds. Make sure you and people around you follow good respiratory hygiene, meaning cover your mouth and nose with a tissue or into your sleeve at the bent elbow. I'm just reading what the ministry is saying. Just telling people.
But unfortunately, you have to sit in the same buses with
other folks. Yeah, right.
So tens of people coming to work because you have no option. You can't use the bikes again.
That is a very interesting angle that you've taken. I didn't even think about that.
I'm just saying because
that's solo travel.
Exactly. That's you are the only person with the bike. So your risk is just between two people. But now, even without the ban on bikes, people crowd themselves. BRT buses, people stand. People hold stuff. You'd be surprised that this is probably one of the biggest spread. Would create an avenue for the
Right.
massive spread of
Look, see, that's why we have the best analysts on the show who actually think very good. I didn't even go there. I didn't even think of that. Benga Kamo says, so the virus is here. It's essential that we go into overdrive about this, like the case of Ebola. It was brought in this time by an Italian. Yes, Benga, that is correct. All right. So please, everybody, do stay safe. I want to get your thoughts on this this startup that is trying to aggregate orders for drugs and so on for other pharmacies within Lagos. I believe they're called
Life stores.
Life stores, yes. Explain the business model for folks. I think.
So basically,
Yeah, go ahead.
The thesis for livestock is the fact that they've observed clearly that Nigerians take their pharmacists, okay, in this case chemists,
Right.
They take advice, diagnosis or everything from their retail pharmacists, right? So what life stores, among other things, they're trying to do is to figure out a way to ensure that yes, genuine drugs and medication get to the neighborhood pharmacists or pharmacists, right? And then we have diagnostic equipment available in these stores so that people can come in to this store, because these are things that we do anyway. So just go to your chemist, like, hey, my head is aching, I have cough, I have this. Okay, the chemist knows exactly what to give you without going to the doctor to get anything done, without going through any medical diagnosis. You just talk to one person that has a bunch of drugs behind him, and then he's able to give you any form of treatment or medication that you require. So Lifestores is trying to formalize this system by ensuring that, number one, genuine drugs get to these people, brand these stores, right, and then also offer first level care, like primary health care services, leveraging the pharmacy distribution chain.
And they're using their own software platform.
Exactly. So, well, yeah, there's a tech platform that allows them to manage inventory, manage patients, all of that.
I also understand that since most of the pharmacies in the country operate almost independently, when they are placing their orders for drugs and so on, they are doing it independently,
exactly.
So their costs are higher.
So right now, what it does is that Lifestores is able to monitor, inventory across multiple pharmacies.
Yes.
It's able to place a single order and then get better pricing because it's placing a single order from or larger orders, and then is able to now distribute across his own pharmacy chains.
Okay.
And I think that's what it is.
And I understand that they were inspired. At least they now listed the number of investors that they, because I know they did a $1 million raise or so, and then most of the investors that backed them were swayed by a company in Ghana that also is doing the same thing.
M-Pharma.
M-Pharma. Yeah.
Yeah.
So this is a system that seems to work.
There's a big problem. So we need to understand that there's a big problem when it comes to genuine drugs and pharmacies. I was talking to, I think, the CEO of Health Plus. I mean, she was also profiled in this article. She was talking about the fact that because of the way regulation is in Nigeria, a pharmacist is assigned to one store, right? So it means that if there is not enough pharmacy penetration, there can't be enough,
distribution.
Exactly, distribution, because you can only own one store.
Okay.
So that's what. And then most of the biggest stores that are able to what's it called?
Have the distribution.
Issue or have prescription drugs are centralized in around cities, so Lagos, Abuja, Port Harcourt. But if you move outside of these major cities to Ijebu-Ode, to Shagamu, to Arep, all of those kind of places, you find out that yes, people just do anything they want to do across all of this. So the system is already broken. So it's just trying to figure out how can we make the system a lot more efficient, get genuine drugs across people, and then get primary healthcare to people, leveraging the habits that they typically do before. Talk to their pharmacists.
All right, cool. Taiwo, welcome to you. Welcome. Let me quickly read this message here from Folabi. He says, Rotus Fisaya, we have a viable human virology lab at the Nigerian Institute of Medical Research in Yaba. But again, it's in Yaba, it's still in Lagos. We also have private biotechnology laboratory like FOM Biotech who are into API research. Okay, and then he corrects himself. He says I actually meant FOWM Biotechnology Limited in Yaba. So Falabi, what about outside Lagos? Is what I'm saying. It's good. This is good, but then outside in other states, if what if the Italian came into Abuja or somewhere else? Let's see now. Okay, Ife and others are talking about the other cases of corona that have been breaking out, and people are now. Enyichuku sending a message here from the Ministry of Health about everybody being careful, staying clean. Let's see. And Yinka, of course, is replying about what you said about government, and he's not trusting government to be able to handle this. So, of course, it wouldn't be Yinka if he didn't criticize government. Taiwo, I want to flip this around. There's another company that is trying to do the same thing with food. Now, this, of course, the flip side of this is that what this company is doing with the pharmacies, that's B2B. This now is B2C, where they are trying to, I think they're called Price Pally. It's a group buying food platform.
Okay.
Yeah. So I guess four of us in the studio here, if we wanted to order food, we'll be able to get it directly from the source through this platform. Do you think, I mean, with B2B on the pharmaceutical side, trying to aggregate for drugs and so on, versus B2C, where individuals, I mean, you have to bring in income and all these other things into play. You think you think that same model can work for buying food?
It can. I mean, where I think that they would struggle would be in terms of logistics and distribution. If you're buying foods, especially perishable food items, how do you preserve them? And how do you move them across various parts of the city? So they really have to have an intelligent system that allows them to group orders together based on geographical location. So, for example, if 5 of us are ordering, and one person is in Okokomaiko, one person is Agulejika, the other person is in Ikorodu, another person is these are places in Lagos,
Right.
So another person is in Ikorodu, and one other person is in VI, and then another person is maybe in Lekki. At the end of the day, it'll be tough to be able to distribute to everybody, within a certain time frame and so on and so forth. Yes, in terms of it makes sense because you encourage bulk buying and it becomes cheaper ultimately for everybody. Like you said, similar to what Life Stores, the story you just covered, I just spoke on. So, but in terms of the logistics, then then you'll be able to say, look, okay, let's just group the orders that are similar together within a certain radius, and then be able to distribute. That's the primary challenge that I see there. Otherwise, I think it's a good idea, especially people who go to the office who are always sometimes they're too busy to get stuff done, or everything is in a hurry. And these days of traffic, you just want to outsource as much as you can.
Right.
To be honest.
Okay. Ike says, just wondering how antibacterial hand sanitizer can be effective against a viral infection. That, I think, is a good point.
Well,
It's a good point there.
it's one of the ways you beat. That's how, I mean, they're beating most of these viruses. Whether it's the MERS one, the SARS, and all, because they're all parts of a larger coronavirus family. So this belongs to the fifth group. Sorry, yeah, fifth group was about until level 4. So these are the ones that really caused them. The idea is that we use our hands to do a lot of things, consciously or unconsciously. So you touch a door handle, and somebody who touched that door handle previously, or maybe even you'd sneezed and you used your hands to cover your mouth, and you have the droplets in your hands there, and then you touch the door handle. Unknowing, again, they're just things we do like that. You touch a surface, or maybe you shook somebody's hand, and you don't know what that person has done with their hands. You to collect a pen from somebody, and so on and so forth. You open a car door, and all those things there. So the whole idea, and then again, you use that hand. Something's itching your eye, you put it inside. The people that pick their noses,
We get.
I think his argument is the fact that hand sanitizers are not effective against viruses. So if it's a virus,
it's a multi-level thing,
right?
And that's what we need to understand here. First, there's the human contact, or whatever, can just spread. It's airborne, so it can be transmitted. And so so before we shout a lot there, it actually has a lower chance of surviving here than it is in other parts of the world.
Yeah, I mean, I've been hearing that, but I think
because I've done extensive research there. The cold actually provides an insulation for the virus, so it lasts longer outside the human body.
Okay.
So in temperate regions like tropical regions like ours, where the temperature is warmer, the viruses die quicker outside the human body.
But it's been noticed in Brazil now. And Brazil is tropical. Like Brazil, okay, it's just. Anyway, look. Well, I don't know, this is not medical
maybe
tech
there's
Friday. Yeah.
sorry. So,
What?
so maybe this is the good news. I mean, this is good news for people that have been shouting about the heat in Lagos, right? I mean,
The heat might kill it.
yeah,
Yeah.
so the heat will just.
I'm not convinced. Cool. I've heard it, but I'm not totally convinced. Anyway, Don Pius. Our government should have been more proactive. They should have known that passengers coming from Italy should have been quarantined since the outbreak of the virus last week. My sister came in from Italy last Sunday. I asked her if she was profile. She said no. Our government should be doing more.
They're doing no checks at the airport.
All right, guys.
Well,
real
they're
quick.
doing-
No, they are doing checks at the
They're
airport.
doing
Our airports, they are.
Now we have 1 minute.
Okay, 1 minute, real quickly. Our startups, TechPoint research showed that we've got, well, maybe this is obvious, less funding from our local VCs than foreigners.
Yeah, because there's no local money.
On the one hand, on the other hand, that is that the local investors are saying, look, show us where the real business is. A lot of these things that you guys are using to mask as tech, to us, are, we don't see where the real money is. We don't see.
So
we
how
don't see
come the
real
foreign
business.
investors have more faith?
No, they
They
don't
have
have
more
more
money
faith.
to throw around.
No, they are assigned small money for
For
African
Africa.
to help
See him
Africans.
waving his hands, yeah?
Yes.
What was he saying at the beginning of the show? You're okay. Fisayo, we're running out of time. Taiwo, we're running out of time. Lagos, please stay safe this weekend. Wash your hands. Do everything you got. Maybe stay home, but then now affect business activity. This thing it's insane. Thank you all for your messages. Ugo, Ezugo, Don Pius, Benga Kamo, everybody else. Business Express will see you on Monday. Stay tuned all day long. Smooth 98.1 FM. All right. Start late, end early. You gotta
Hey
love
man, did the rain get you?
it. You gotta love it.
It's not cool chop now because we don't want to be shaking people here.
Let's show them it's possible. You see, beyond any possible shadow of doubt, it's possible to shop from over 100 international stores on QuickTeller Global Mall. Cool, right? And since I know you want the best of all possible worlds, it's also possible to pay tollgate fees, fund your betting wallets, and buy tickets to as many events as you can possibly attend. That's not all that's possible on QuickTeller. It's also possible to send money, pay your estate levy, electricity bills, school fees, and buy airtime. So you see, everything is possible on QuickTeller. So download the QuickTeller app or visit www.quickteller.com. QuickTeller, everyday payments made easy.
This is Swiss breakfast on your dial, just the way you like it.
Don't you just love holiday seasons? It's a time to relax, eat a ton of food, and spend precious time with the people closest to our hearts. And speaking of spending time with loved ones, your Easter trips just got easier with Travel Wings Easter discount promo. You can now travel to celebrate this Easter with your family and friends at unbelievable prices. So what are you waiting for? Hurry on to travelwings.com.ng or call 016-361010 to book your tickets now.
Travel Wings, get your wings to fly.
All right, studio.